Hello learners, this is quick revision series from anatomy, especially about injury. So here we are going to see some mechanism of injury and their impact on the skeletal system. First, fall on outstretched hand. It is also known as whoosh. When a person fall on outstretched hand, or any severe force which is given to the shoulder, such as falling directly onto the shoulder, that actually transfers the force to the clavicle. So as a result, collar bones gets fractured. So clavicle fracture is the most common thing. Other than that, if a pressure is given to the hand or the wrist, then the fracture will occur in radius, especially in distal radius. So most common fracture which occurs in fall on outstretched hand, that is distal radius fracture. But in case of children, supracondylar fracture of humerus occurs. Next comes dashboard injury. Actually, this dashboard injury is often refers to indicate the posterior hip dislocation. It is actually caused by a knee striking the dashboard during a car accident, and because of that knee impact, you may get posterior cruciate ligament injury as well as femur or tibial fractures, but actually it refers to posterior hip dislocation, sometimes femoral head injury. Next, fall onto heel. As you know, nothing. This actually causes fracture calcaneum. Other than that, spinal compression fractures due to the transmitted force from the heel to some other parts. Next, hit by stick in forearm. This is also known as nightstick fracture. And the possible injuries are ulnar shaft fracture. Other than that, some other soft tissue damages and contusion occurs. But most common thing is fracture ulnar. Next comes slip in bathroom. Again, it is common in case of old people, and it causes fracture femur, especially around the neck. According to the part which gets affected, you may get hip fractures, especially in elderly people. Other than that, wrist fractures, head trauma, it may occur. But most common thing is femur neck fracture.